Hi, this is Dr. P. Mageshwari, Associate Professor, Department of Pharmacy Practice, School of Pharmaceutical Sciences, Vistas. So, we are discussing about HIV and AIDS. HIV is the human immunovirus and AIDS is the acute immunodeficiency syndrome. So, we are going to discuss about this topic: general introduction of HIV/AIDS, symptoms, causes, pathophysiology, diagnosis, prevention, treatment, and finally conclusion. Now, coming to the HIV and AIDS. So, HIV is the human immunodeficiency virus. So, HIV is a virus and is an infection, and AIDS is the acute immunodeficiency syndrome. So, AIDS is the stage and it's not a disease. Okay, so coming to the what is HIV? So, HIV is the short form of a human immunodeficiency virus. So, once they infected with HIV, a person is referred to as a HIV positive, and HIV positive person can look healthy for a long time and after first becoming infected. And what is AIDS? So, AIDS is the acute immunodeficiency syndrome, can take many years to develop, and eventually the virus kills or impairs more and more cells in the immune system, and the body loses the ability to fight off common infections such as diarrhea or cold. People with AIDS can die from disease that are usually not dangerous for people with a healthy immune system. So those who are having healthy immune system, it's not a dangerous disease for the person. From HIV to AIDS, so AIDS is diagnosed with a CD4 blood count is 200 per microliter or lower and have an opportunistic infection. So a healthy blood count may range from the 800 to 1200 per microliter CD4. So 800 to 1200 per microliter CD4 count is normal range, and if it is below 200 per microliter CD4 count is the disease state. So those who are having HIV positive, they are having very less CD4 count, that is less than 200 per microliter. And how HIV can be transmitted? So unprotected sexual contact, be it vaginal, oral or anal with an infected partner, and sharing the unsterilized needles or syringes with an HIV positive person, for example when using drugs or in a healthcare settings, and during pregnancy or birth, and through the breastfeeding from an HIV positive mother to her baby, and blood transfusions with the infected blood. And coming to the epidemiology, so India's HIV and AIDS profile. So demographically, second largest country, 1.1 billion people affected with HIV in India. So third highest HIV infections, 2.47 million. It's after South Africa and Nigeria, and over 85% of sexual transmissions. And coming to the epidemiology, so the males are more affected compared with female, and occurs in all ages and ethnic groups, and all areas of country are affected. In some city inner areas, as many as 50% of males are HIV positive. AIDS is now the second leading cause of death for all men aged 25 to 44 years old. Unintended injuries is the first place, and heart disease is the third place for this age group. And coming to the HIV prevalence and estimate, so prevalence is the number of people living with HIV/AIDS in the given year. So at the end of 2003, estimated 10,39,000 people to 11,85,000 persons in the United States were living with HIV/AIDS, with 24% to 27% undiagnosed and unaware of their HIV infection. So 80% of Americans with HIV do not know they are infected. So 1 out of every 100 American men is HIV positive. The rate of infection has reached epidemic proportions in 40 developing nations. And coming to the symptoms, there are basically 5 types of symptoms as follows: pulmonary infections, gastrointestinal infections, neurological and psychiatric involvement, and tumors and malignancies, and other opportunistic infections. And coming to the symptoms, List of symptoms of HIV/AIDS. More common in develop a brief flu-like illness 2 to 4 weeks after becoming infected. Signs and symptoms may include fever, headache, sore throat, swollen limb, glands and rashes. And symptoms like main symptoms of AIDS, neurological encephalitis and meningitis, in eye, retinitis, in lungs, pneumocystis and pneumonia, tuberculosis and tumors, in skin, tumors and gastrointestinal epigastritis, chronic diarrhea and tumors. Then coming to the causes, sexually transmission. So in age 24 to 49 years, a sexually active group. In sex, male, homosexuals and bisexuals are more common in North America, Australia and Europe. Uncertain sexual practices increases the disease pattern and multiple sex partners. And sexual contact male to female or vice versa, and female to female. An overview of pathophysiology. So HIV destroys the body's immune system by selectively attacking the T4 lymphocytes and also macrophages and B cells. So HIV indirectly affects the CNS by neurotoxins produced by the infected macrophages. So as the CD4 count decreased, body becomes more susceptible to opportunistic infections. And coming to the pathophysiology, so it's the HIV life cycle, adsorption, so it's the attachment of virus to the host cell, and penetration of the virus into the cell. And third one is the uncoating, so the genetic material or viral genome passes into the host cell. And transcription, production of the viral mRNA from the viral genome. And translation, reverse transcriptase, viral genome enters the cytoplasm or nucleoplasma and utilizes the host nucleic acid machinery for the synthesis of new viral protein and for the production of the more viral genome. In HIV life cycle, and sixth is the assembly of the viral particle. So new viral coat protein assembles into the capsid and viral genome, and finally release. So release of the mature virus from the cell by budding process. So the maturation and release of virus, the half-life of this process of HIV into the mature virus is about 90 minutes. So each infected cell can produce an average of 250 new virions by budding before it fails and dies. And stages of HIV, so category A, category B and category C. So category A is the acute and asymptomatic HIV infection and persistent generalized lymphadenopathy, and category B symptomatic but not a condition of C, and category C is the AIDS defining conditions. So coming to the phases of illness, so HIV negative and HIV infection and zero conversion of the illness, and HIV positive asymptomatic, and finally patient will be getting the symptoms, that is symptomatic. And stage 1 is the primary. Short flu-like illness occurs 1 to 6 weeks after infection, no symptoms at all. Infected person can infect other people. And stage 2 is the asymptomatic and lasts for an average of 10 years. This stage is free from symptoms. So there may be a swollen glands. The level of HIV in the blood drops to very low levels, and HIV antibodies are detectable in the blood. And stage 3 is the symptomatic. So the symptoms are mild, the immune system deteriorates and emerge of opportunistic infections and cancers. And stage 4 is the HIV to AIDS, the immune system weakens, the illness becomes more severe leading to an AIDS diagnosis. And coming to the diagnosis, the CD4 T cell count below 200 per microliter, it's diagnosed as the AIDS. And diagnosis, ELISA, enzyme-linked immunosorbent assay, antigen antibody test. So antibodies are detected by the initial test based on the ELISA method, and Western blot procedure determines the size of the antigens in the test kit binding to the antibodies. And coming to the prevention, sexual contact, use condoms, female or male. Every time have a sex with vaginal or anal, and always use the latex or polyurethane condoms, not a natural skin condoms, and always use a latex barrier during oral sex. And coming to the prevention, exposure to infected body fluids. If a needle or syringe or cooker is shared, it must be disinfected. Fill the syringe with undiluted bleach and wait at least 30 seconds. and thoroughly rinse with water. Do this between each person's use. And coming to the prevention, mother to child transmission. So HIV infected mother should avoid the breastfeeding in their infant, and zidovudin full dose trimester 2 and 3 plus 6 weeks to neonate reduce the vertical transmission by 80%, and neonate 1 dose of nevirapine within 24 to 72 hours after birth, and zidovudin for 1 week. And coming to the treatment, reverse transcriptase inhibitors, zidovudin, diadenosine, zalcitabine, stavudin, and lamivudin and abacavir. And coming to the non-nucleoside reverse transcriptase inhibitors, delavirdine, nevirapine, and efavirenz. And HIV protease inhibitors, indinavir, ritonavir, sacunovir, and lopinavir. So these are the anti-viral drugs. So coming to the treatment, ritonavir and zidovudin. So coming to the mechanism of action, it inhibits the HIV replication and inhibits the reverse transcriptase enzyme. And second one, non-nucleoside reverse transcriptase inhibitors in nevirapine. It directly binds to the reverse transcriptase enzyme and blocks the DNA polymerase activities. And third one is the HIV protease inhibitors, that is indinavir. Mechanism of action, it binds reversibly to HIV protease, which prevents the cleavage of the viral precursor to polyproteins. As a result, immature viral particles incapable of infecting of other cells are formed. And for the antiviral drug, the Nobel Prize for the medicine. So German professor Harald Zuhassen in left side, and French professor Lou Montagnier in center, and virologist Francois in the right side were awarded the Nobel Prize for the medicine in October 6, 2008. And why should I have to know about it? There are no cures or vaccines for HIV and AIDS. Currently, awareness and education is the only way to prevent the infection. And AIDS death in 2007 estimated 2 million, while the range is 8 to 2.3 million, and more than 25 million people have died of AIDS since 1981. Thank you. Thanks for watching.